wanted to start by thanking and commending Anthony for putting together this amazing group of people who are so passionate about the applications of AI in healthcare. What I want to do this morning was expand on the conversation you started last evening when you asked the panel, what will the future of health be like? What will healthcare be like in the future? I wanted to particularly focus on primary or ambulatory care, the outpatient part of medicine. If you think about it, most of us don't end up in the hospital in a given year, but in fact, most of us spend have 2 or 3 visits with the doctor during the year and interact with and access the healthcare system as an outpatient. And what is that experience like? What is it like? What is the current state of healthcare? I would argue that accessing healthcare is really quite inconvenient. You need to call the office and physically travel to the doctor, usually, to get healthcare. It's incredibly expensive. We spend more than $500 billion in the U.S. alone on outpatient care each year. At the same time, it's wasteful. A lot of care delivered is actually not needed and, frankly, very expensive. So the cost of extra care that's needed and care that is not the ideal care given is actually a major part of the wastefulness of our system, making it inefficient. And frankly, we don't get the kind of outcomes that we really ought to get or should expect to get with the kind of effort and intensity of expense that we have in the healthcare system. So what I wanted to do was ask us collectively to think about what would the future of healthcare be? What will it be like when this future comes? The reality is that we have experienced transformation of how we access our lives in multiple sectors already. If you think about our ability to find information through the internet, the transportation experience, and particularly with Uber, think about commerce, and Amazon comes to mind there as the organization that's transformed how we access commercial transactions. And similarly, entertainment. We no longer go to Blockbuster when Netflix is there. So let's think about how healthcare can be and will be transformed. I'd argue that healthcare transformation is hard. I think we all know that. But it's inevitable. It will happen. And it will happen to address the needs. I wanted to focus now on the aspect of experiencing healthcare and what it is that needs to happen that will satisfy what it is that people want. So what is it that consumers want? As a patient, what would you like to have? And what should the healthcare journey be for someone that needs access to care? Well, I would argue that it starts with a health concern or a question, and that the people actually ought to be able to find trusted answers. When you go to a search engine today with a health query, you get lots of answers, but those answers may not be in context relevant to you, and more important, they may not come from a trusted source. So I would argue that in the future of health, it should be possible to get a trusted answer that is relevant to the person who's asking it. So the reliability and trustability of the result is really important. And then, of course, many people actually do need to get care, and that care should be easy to access. And it should be the right care. The right care at the right time and the right cost is possible in the future with a digital health platform. Similarly, the other side of the user experience, of course, is what the healthcare providers, in particular doctors, would like to do. And I would argue that the future of health will include solving the problem of what it is the doctors want too. And what do doctors want? Fundamentally, we go into this profession because we have a desire to help people. At the same time, it is our profession and we do need to make a living, but we're human beings. I'd like to comment that tragically, the problem with doctors is that they're human. People sometimes forget that. But doctors want to have fun and feel good about what they do, and I would argue that in the future, the systems will make it easier and more possible for doctors to actually enjoy their task. And coupled with that tightly, as Anthony was commenting, related to the healthcare provider burnout, doctors would like to spend less time doing administrative, clerical, and other tasks such as clinical documentation. And in the future, it will be possible for all of those tasks to be expedited for doctors. As you think about the kinds of care that are needed in solving people's healthcare problems, many people, there's a funnel. There's a high volume of people's information needs and concerns and queries related to health that really don't require professional health care. If you think about it, we visit the doctor a couple of times a year, but the average person does between 10 and 20 searches, health-related searches on search engines on the internet. So our need for information is far greater, and this should be possible to deliver a personalized, in-context, trusted answer to people who have health questions right away, and that should be low cost and immediately available. Similarly, at the next step, people have concerns. They discover that they actually need a personalized attention and to get an answer from a question. It should be possible to get informational answers that are personalized to an individual from a professional easily and quickly without actually having to see that professional in person. Some people need to actually interact directly one-on-one with the doctor, and of course the ability to reach the right doctor and do a virtual consultation with that doctor should be possible. If you don't need to see the doctor in the office, why in heaven's earth, why in heaven would you want to go to the doctor's office if it was possible to interact? In our current era, we expect to be able to do transactions and manage our lives on our devices, and why shouldn't you be able to immediately connect with the right doctor to get your healthcare problem solved straight away? Similarly, the doctor may discover, or you may interact and realize through the interaction of a healthcare system that you need to go and see the doctor. Well, which doctor, what kind of doctor, and with what urgency should be immediately part of how the interaction with the system gives you guidance to the right doctor at the right time. And this may, of course, also include a more urgent situation in which you need to see the emergency department. So this is really a diagrammatic representation of the different level of services, all of which should be given to people at the right time. And in the future, I can say that our healthcare system will make it easy for people to find the right care at the right time. Another way of looking at it is to look at the journey of what kinds of services and capabilities people should access. Starting in the lower right content, we talked about being able to search, finding questions answered, finding content to learn about things that you're interested in related to health. Asking a specific question that's related to you would be the next step. I would argue that the question answer should come ideally from a trusted source. We, for example, have asked doctors to directly answer questions that are informational in nature and have been quite successful in getting more than 100,000 doctors to actually answer such questions, building up a library that allows people to find an answer which is trusted from a source immediately online. The next step, and this is really where AI comes in, which is the idea that in the future, the system that you interact with will be intelligent and will be able to understand what the concerns are and actually take a next step level, which is use a knowledge-driven or AI-driven approach to understand, to collect information about you, and to give more guidance and advice built on an understanding of what the possible medical issues that you have are. At HealthTap, for example, we have a Doctor AI service that does just that, a guided medical interview that creates a scenario which is all of the symptoms and associated risk factors that you have. The interesting thing in the future about such systems is that they'll be as smart as the doctor, even though they can't take responsibility for the final care. Giving a diagnosis online for free, I don't think is going to happen anytime soon. We talked about that yesterday, the need to have a responsible party, if you will, to actually take care. On the other hand, such systems can augment and support what doctors do. So that when you do see a doctor, moving around the circle here, when you do see a doctor, the doctor should have a leg up. The doctor can be given all of the information about you that you've shared with an AI-based system so that at the point of care, the doctor can focus on the things that only the doctor can do, which include, of course, caring about the patient, being empathetic, but also diving into the real-world issues that define the difference between a static patient scenario and the reality of what is involved for any individual person. The next step, of course, after you see the doctor is getting treatment, getting a recommendation online, if it's possible for that diagnosis to be made through a virtual visit. Then it should also be possible to deliver the care virtually so the doctor can immediately send prescriptions to the pharmacy and or arrange for other treatments. I think in the future we're going to see tremendous applications of AI. When care is delivered on a digital platform, it becomes possible to observe and learn from the care that's done. As a result of that, we will see over time much more applications of decision support and an understanding of what works and what doesn't. And I think the future of AI on the platform will very much center on what works and how to support. This is an area where we are really only seeing the very beginning efforts now. And of course, this is all tied together with the idea that your profile stored, any system that you're interacting with, should know about you. We've had real problems with integrating health information across multiple systems. Today, most people's care is disjointed. When you visit different providers, they don't know about each other. In the future, healthcare should include the opportunity for each person to have their own copy, their own record, and all of the healthcare interactions should be driven by an understanding of what you've already done. So in fact, what these in the future, what we will see is that consumers will get the healthcare that they want, which is at this intersection of personalization, intelligent or AI-powered capabilities with crowdsourced expertise. At HealthTap, we've shown that this works by inviting doctors to participate with us. There's actually several in the audience today. I'd welcome you to interact if you are curious to understand why they do this, why doctors actually crowdsource their expertise in an effort to create a library of content and support people at a scale beyond what's possible to do in the office or one-on-one with patient interaction. So I would love to spend more time talking about the specifics of the doctor experience, because that's another side of how the application or support for the doctor care is a critical part of the future of AI, but I think we're running out of time here. So I wanted to comment that virtually everything I've talked about is actually already present and functioning on a platform that provides end-to-end care, starting with the question, going through the consult, and allowing for treatment. And so I'd like to say, to paraphrase what Anthony has said, the future's already here, it's just not yet evenly distributed. And I'll stop there.
Thank you. As you're in Silicon Valley, all three of you, and you have just ongoing barrage of technologies thrown at you, at the same time, we can't even do very basic things well, like getting patients to come see you in the clinic, compliance with medications, mental health aspects is just not even really seriously tapped into. So how do you balance the two divergent sort of trends in healthcare?
A great question. Great question, Anthony. I'd argue that certainly the perspective we've taken at HealthTap is one of creating a solution. We created the company as a direct-to-consumer company rather than as a for doctors or for healthcare system, with the understanding that creating an environment, an application, a service that people wanted to use was a critical first step, and that bringing people to an application, a service that actually helped address those needs, as I talked about what it is that people want, that systematically giving people a place where they could go to get, in this case, an answer to their question as a first step in identifying what help they needed to move forward. So fundamentally, I think the answer to your question is creating systems that actually directly address the needs that people have at the point of that need.
Jeff?
Well, I'd agree that we need an advancement and update, if you will, of the medical curriculum. I would point out that there's really two sides to this. One is an understanding of what the limitations and functionality of the technology is, and the other really should be, in my opinion, a renewed emphasis on what it is that makes physicians doctors' physicians, right? What it is that is required to actually do the things that are uniquely human for a doctor. And the combination of understanding the role of the physician in caring for the patient needs to be coupled with an understanding of how to use the technology, what the strengths are, what it's good for, and how it benefits and supports all of the things that the doctor needs to do. If I could double down on that, I think it's a real wonderful example of how true this is, that you need to be in the workflow and supporting the actual process that goes on. If you look at the history of AI in medicine, for example, we 20 years ago created systems that you could consult with, that were designed for doctors to consult with to get a better answer.
The expert systems.
And they were a complete failure because they required a workflow that was different. And today we're in this wonderful place. I hinted at some of it with where we're going with this, when what we're actually already doing already, which is at the point of care, if you can take the task the doctor's already doing and make it faster and easier and provide support. So for example, if you can do the routine parts of a medical interview and write the note for the doctor before the patient comes in, allowing the doctor to focus on that. And because it's an AI solution, that system can also provide the doctor decision support. Hey doc, don't forget to think about, here's the top rated things that are likely explanations for all the things the patients told me even before you saw them, so that you can reduce the amount of time it takes for the doctor, let the doctor focus on the things that they're best at, and speed the process so that addressing issues related to burnout and better care.
What do you think is your best tool that you can offer in your portfolio for global health?
Oh, that's a big question. Good.
I can take a start, since it was one of the missions of our company to help people in any way that was possible to do for free, if you will. I invited doctors to participate answering questions and putting those answers into a library that was then available for free on the internet. So we've now got multiple millions of answers. We have the doctors peer review the answers so you can tell which are the good ones, and we make that available for free around the world. And more than 137 countries, people have accessed hundreds of millions of times the information for free. But this idea that there ought to be a global resource of everything that's possible to do in an automated way, available to anybody, anywhere, for free. And a lot of it, there's some substantial progress there already.
Wow, all of you have really